Friday. It is Good Friday after all. To date, 1.619073 people, 1.6 million 119 and 73 people have tested positive for the COVID-19 virus globally. Global deaths stand at 96,966. On our part, today we mark our 30th day of collaborative concerted efforts between the national government and many actors to stop the spread of the virus. Indeed, our ways of life have changed dramatically. In ordinary times, today being Good Friday would be that special day in our Christian calendar when we congregate in our churches and homes with families and friends. But this Easter period is different. Because of our current circumstances, we requested you to pray and reflect in the confines of your homes. I want to thank those Kenyans who complied in this effort. The true meaning of Easter is victory over death, hope over adversity, and light over darkness. Let us use this occasion to stoke our hopes for a bright future and to rededicate ourselves to this fight of our times. Let us remember our frontline heroes at a time like now. Those are our medical staff and health workers, our diligent scientists and researchers, and our volunteers. Let us pray for our nation so that we may get it right and put all this behind us. Today, I want to remind you of the dangers posed by handling of physical money in business transactions. In my earlier briefs, I encouraged you to transact electronically, minimizing handling of cash. Despite mobile money operators facilitating the ease of doing e-transactions, we have noted with concern that people continue to disregard this advice. Once again, I am asking you to take all the measures that you can to avoid exchanging notes and coins. Physical money presents surfaces that can very easily be contaminated with the virus. Avoid it. This is for your own good and for the good of the country. We also note that there will be a challenge in disposing of face masks. The Ministry of Health, together with the Ministry of Environment and other government agencies, have developed and circulated a protocol on COVID-19 waste management to the county governments for operationalization. In the meantime, all of us are advised to properly dispose of face masks to avoid contamination in line with that protocol. We continue to enhance our capacity and capability within our health facilities to combat this disease. To date, over 100,000 healthcare workers have been given COVID-19 related training. Over 4,000 doctors across the country have benefited from an e-based training on the same. We are enhancing testing and other capabilities. We are now able to undertake an average of 600 tests a day. This number will be scaled up in the coming days. Indeed, today we received Roche 19 testing extracts, which creates our capability to test automatically rather than testing manually as we have been doing. So today is actually the first day that we are going to test automatically. We are going to use our automatic machines that exist in Kemri, which we could not use before because the reagents that we had were not capable of being used in those machines. To continue to enhance our readiness at the counties, and in collaboration with the Ministry of Energy, Kenya Power and Lighting Company, we will fast-track the connectivity of three-phase power to our various county facilities so that they can fully utilize medical equipment to effectively manage COVID-19 patients. You will remember that under the management equipment services, there are equipment lying in hospitals that we have been unable to use because of lack of three-phase connections in the various facilities. And working with the county governments, we will provide the list of these facilities to Kenya Power. And in our discussions today with them, they have said that they are going to fast-track connectivity. What that means, in effect, is that we will be able to utilize the facilities, for example, respirators that we can use as ventilators in just about all our hospitals in the county governments where this equipment had been taken to, and multiplying our capacity in an instant. I want also to clarify that the hiring of the 5,000 health workers I announced earlier in the week will be done by the county service boards. I am aware that there was an advertisement by the Public Service Board to the effect that people should apply to the Public Service Board. We have consulted with the Public Service Board and agreed that this hiring of the 5,000 health workers had been agreed with the Council of Governors, that this activity will take place, but it will be conducted by the county service boards. So that will be corrected. But in the meantime, I am asking all those wishing to apply to direct their applications to the county service boards. I would also like to confirm that with the increased capacity that we have given priority to testing of all our medical personnel, which is what we have started today. Fellow Kenyans, since our last briefing yesterday, we have continued to test and managed to test some 504 samples. Out of this number, some 5 have tested positive for the coronavirus disease. Therefore, we now have 189 Kenyans with confirmed positive, confirmed as positive. These 5 people are all Kenyan nationals, and only one of them has a history of travel from the UAE. 3 of the cases are in Mombasa, while Nairobi and Nyandarua have 1 each. 1 case came from mandatory quarantine facilities, while the others were picked by our surveillance teams. The 5 are aged between the ages of 27 and 58 years old. 2 are male, while 3 are female. But I'm also glad to note that today, an additional 10 individuals will be discharged from our Bagathi COVID-19 isolation facility. And this is good news indeed. It is a Good Friday. For the first time in a day, we released more people than we took in. The individuals have tested negative twice, and that brings in a total of 22 individuals who have recovered from the disease. As of today, a total of 2,054 contacts have been monitored, 1,481 have been cleared during the follow-up programs, and 573 remain in our monitoring program. To date, a total of 6,192 samples have been tested. Once again, I would like to reiterate the importance of observing the various measures and guidelines issued to combat the virus. I want to remind our young people, the youth, of the discussions that we have had on the various days on the role that they can continue to play. And I'm glad to report that we have had communication with a lot of youth groups who have contacted us with ideas on how they can help in the villages, in the estates, and we continue to encourage them to do so. I also want to remind those sectors that we have been addressing on the matters of cleanliness, especially on the streets, in the markets. Yesterday we spoke at length to our mothers, our sisters, our aunties, our brothers and sisters who are working in marketplaces. And we said, and I would like to remind them again and again, that please keep social distances even as you work in our markets. I also want to remind our barbers, those who work in saloons, those who work in matatu operations, in the public transport sector, I want to remind you that you must not ease off what we have said and what we have agreed we are going to do working together. Let us not ease off at any time. Let us keep remembering that the disease is not slowing. The disease is continuing. But if we continue to cooperate, if we continue to do what we are supposed to do, there is a chance that we might be able to arrest it before it becomes a disaster that it has become in many, many parts of the world. And we cannot afford to ease off, because if countries like America that have got the kind of resources that they have, if countries like Italy can get overwhelmed, then you can imagine what would happen to this part of the world if similar circumstances were to arise. So I wish you well. I wish you a happy Easter as we continue to pray in our homes and as we continue to engage our families. Thank you all very much. Okay. On the issue of masks, is it time to rethink the strategy of masks so that the surgical masks, N95, remain as a preserve for the healthcare workers, and the public can utilize all other kinds of masks to see that there's a shortage and the cost of the surgical and the N95 is going up. And last week, there's a appraiser on, it said on Tuesday that by the end of the week, there will be 10,000 PPEs distributed to healthcare workers across the country. Now we've come to the end of the week. Yes.
So my name is Nancy Kwara from KBC, and towards the end of March, you had predicted that by the end of April, Kenya will have recorded 10,000 cases. And given the patterns that you have been witnessing so far, especially today we recorded 5 cases, yesterday 5 and today we had 7 cases. Are we still working on that model? Are we working with that, or there have been any changes?
Caleb, I think my question was nice to Gary's question. However, what is the status of PPE's distribution? Considering that the Kenya Union of Military Officers have said that not even up to 50%, and the government has said up to 80%.
Yes, please. I think the issue of Mandera was addressed yesterday in terms of what we had wanted to do, because as we had said, we wanted to go to Mandera and take a lot of other equipment rather than just take a whole plane to bring in 2 samples or 3 samples down. So we are still working on that premises. And as far as the PPEs are concerned, yes, we have got the PPEs that we have said. We have got the 10,000 PPEs. We have not distributed them across the country, but we have them. Between the ones that we have received from overseas at KEMSA and the ones that we have made, we have got those. But we had a slowdown on Monday and Tuesday because we had to wait for cabs to clear the materials that we wanted to use as local materials, which we have cleared now. There was a confusion regarding whether we should use the World Health Organization standards or whether we should use the EU standards. And the EU standards were for equipment that is actually beyond even the use that we have in our hospitals. But now we have got that clearance, so we should be able to catch up and distribute in all the areas that we are saying. And the capacity to produce, the capacity we have to produce them is actually more than 30,000 per day. So we will be able to meet that requirement. I'm going to ask Dr. Amoth to report on the issues of the mortalities and so on.
Thank you, Waziri. In terms of the 2 deaths, yes, these 2 deaths indeed occurred, one in Kenyatta National Hospital and the other one in Mombasa. And potential loopholes that could have arisen as a result of this was basically in terms of the case definition. And we have decided as a result of that loophole to be able to expand the scope of the case definition to include severe pneumonia as a criteria for testing for COVID-19. And this information has already been passed over to the clinicians and healthcare workers that anybody presenting with severe pneumonia ought to and should be tested for COVID-19. The measures that we have undertaken as a result of this is, one, to provide psychosocial support to the healthcare workers who took care of these diseased persons. Number 2, we have also gone ahead to ensure that the facilities have been disinfected. We have also placed the healthcare workers who took care of the diseased persons in quarantine for the next 14 days. And of course, contact tracing and testing has commenced to be able to find out whether during that exposure they actually got the virus. Let me also take this opportunity to address the issue of the masks. Yes, we want to appeal to the members of the public, and this will only happen through continuous education and behavioral change, that the N95 mask should